You're tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Here's your host with today's guest.
Welcome to another edition of Recovery TV, and I'm your host, John Tassoni. Narcan, please get it. You can get it at CVS, you can get it at Walgreens, URI. This, ladies and gentlemen, saves lives. We need you to carry it. Thank you. My guest today is Miss Katie Anderson from CCA, and she is the Vice President of Acute Services at CCA. We're going to talk a little bit today about BH Link and what BH Link does and what BH Link offers. So welcome, Katie, and thank you for joining us today.
Thanks for having me.
So give my viewers an overview of BH Link. There's been a lot of talk about BH Link, but I don't think a lot of people know what BH Link is all about.
Sure. So BH Link is a 24/7 walk-in crisis receiving and stabilization center, which is really a fancy way of saying if you're having any sort of difficulty with substance use and mental health and you don't know where to start, there's really no need to go to a hospital or an emergency department. You can walk in, no referral needed anytime. We're located in East Providence, but we have transportation 24/7, so anyone from the state can come in.
You know, the transportation issue has been a big issue. Obviously because of the bridge when it first went down. There were a lot of rescues and municipalities that didn't want to go across the bridge because of that issue. But now things seem to be smoothing out a little bit, and now that you're out of transportation, it's a lot better. One of the things I like about BH Link is that you don't have to sit there for 16, 17, 18 hours in a waiting room. You're seen almost instantly.
Yes.
How is that working out? Since obviously BH Link is only in its infancy, it's what, 4 years old, 3 years old?
Started in 2018.
2018. Yeah. So how is that working out?
Yeah, so when people walk in, they will be greeted almost immediately by a member of our care team in a really trauma-informed, humane way, very different than going into an emergency department where you may have to wait. We have nurses, clinicians, certified peers, prescribers, all of whom our goal is to see you as quickly as possible and to really individualize a support plan for you. We want to get you comfortable. If you're coming in with substance use needs, we want to start your medications as quickly as we can. If you're looking for placement or resources, we want to start that assessment as quickly as we can. Though the physical blueprint of the space is small, we make very creative use of it so that we really have no limit on how many people we can see in a day. As
far as the plan goes, when you sit down with either a clinician, a peer, how would they go about putting out a roadmap for you?
Yeah, it's a great question. We always say crisis is as the person defines it. So some folks coming in are looking for housing. Some are looking for medication refills. Maybe they're between prescribers and nobody can follow them. Maybe someone's just looking for a therapist and maybe another person needs inpatient care. Whatever it is, BH Link is almost like an airport traffic control. Right. We have resources all over the state, both inpatient and outpatient. So we do your assessment, we come up with a safety plan. We want to match you to the least restrictive, most accessible resource for you so that you can get that help immediately. If there is a wait, you can stay in our facility for up to 23 hours, depending on space. We can start you on medications, we can send you home with a script, and we can have you come back as many times as it takes for us to connect you to those services that you need.
Why 23 hours?
It's a great question. Yeah, it keeps us from being a true inpatient unit. We are an outpatient level of care, so we have that limitation so that folks aren't staying with us long term. But you can come back really the next day. There's no barrier on how many times you come in. We're also insurance blind, so you can come in regardless of whether or not you're covered.
So someone comes into your facility that needs more than 23 hours worth of care. What do you do with that individual?
Yeah, we get very creative in coming up with plans to keep you safe and stable in the interim. For some folks, it's really just leaving for a couple of hours. Maybe we're connecting you to an Alcoholics Anonymous meeting or to a warming center or to an outpatient appointment. And then we're helping facilitate your return as needed until those resources are available. It looks different for everybody based on their need.
So, but if you have someone who needs hospitalization,
yes,
you do the transport or you just call 911? How does that work?
So we'll set up, we do use private ambulance sometimes. We also have our own transportation. If somebody needs a true like inpatient detox or a similarly acute level of care, we're doing our best to make that connection and transfer same day, particularly because in many instances we're starting your detox on site. We're starting you on medications on site with the goal being we're admitting you directly into a bed. And we have a very high success rate at doing that.
Housing is a big one.
Yes.
Right now, especially now with the cold weather.
Yep.
What are you seeing with housing?
Yeah, we know there are not enough shelter beds in this state. It is definitely a deficit for our population specifically. It's hard to access housing on the overnight, on weekends, other times when places aren't open. We're very grateful for emerging partnerships we have with organizations like the Rhode Island State Council of Churches, others who are operating warming centers and other non-traditional type spaces. We're getting people into life-saving beds more quickly.
Medication.
Yeah.
Do you have a pharmacy there?
We don't have a pharmacy on site, but we can work really with anyone's home pharmacy from around the state. And CCA also does have a pharmacy that we use.
No, but you had indicated too that you can stop people on medication.
Yes.
So you must have obviously.
We have stock meds on
stock
site.
meds.
Yes, we do.
Okay.
And we have standing orders, we have protocols. So anyone looking for detox from alcohol, opioids, or benzos, we have those medications in-house.
Can you treat people who are just coming out of an overdose, or does that have to go right to the hospital? I mean, obviously medical is medical, and
Sure. Yeah, best practice for somebody who has truly overdosed on an opioid is for them to be seen and cleared in an emergency department. But we do see folks walking in post any number of extreme events. We do our best to assess, and then we can send them to a hospital if needed for further clearance and care.
how about as far as IVs and stuff like that? You able to administer that?
We don't do that on site.
Okay.
Yeah, we are a psychiatric primary facility.
Okay. All right. You know, there's been a lot of, unfortunately, a lot of suicides.
Yes.
That's not reported. Obviously, they don't want to make a scene of it, but there's been a lot of it. Have you seen a lot of people coming in and asking for help in that particular area?
Yeah, and what we know, 1 in 4 Americans will struggle with suicidal thoughts.
Right.
It's actually incredibly common. One of our goals is to reduce shame and stigma around that, let folks know death by suicide is preventable, but suicidal thoughts can be fairly normal. When we work with folks early in their journey to understanding those thoughts, we want them to understand you are not alone. There is help, there is treatment available, and when we start talking about it, just the act of sharing it and of working towards a plan for recovery helps that suffering lessen, and it helps people create some distance between the thought and the desire to attempt suicide.
Yeah. Katie, what kind of background do you have?
I'm an independently licensed clinical social worker.
Okay. You know, I've seen and heard a lot. You know, when I first started getting into this business, it was 1 in 5 families that substance use and mental health would affect. And now we're almost like a 1-to-1 ratio. It's not getting any better at this particular point. But my thought is, I want to talk to you about if in fact we have these issues of these hospital closures. That could be devastating for the state of Rhode Island, even though we're a small state. Do you think it would be helpful that obviously you're in East Providence. We need something down in South County. We need something in Northern Rhode Island. And we need something in another particular area. Do you think it's worthwhile to investigate opening up 3 more BH links?
I think it's absolutely worth assessing the need and really trying to understand how can we serve the greatest number of Rhode Islanders. In the meantime, we know for our East Providence site, we haven't yet found the outer limits of what we can do. We're inviting people to come in. We want to increase our utilization, let folks know they often don't need to be seen in a hospital setting.
Yeah.
But yes, equity of access is an important issue.
All right, we're going to take a quick break. I want to talk more about that when we come back.
Great.
You're watching Recovery TV, and I'm your host, John Tassoni. We'll be right back after these messages.
And now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, Kodak. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Katie Anderson is in the house. She's with CCA. She is the Vice President of Acute Services, but we're talking not about CCA, we're talking about BH Link today. So thank you for coming on today. I greatly appreciate it. BH Link is the best kept secret in the state. And a lot of people, when I go and have conversations, they say, what is BH Link? We, as a group, need to do a better job on promoting BH Link throughout the state. And we had talked earlier about putting up a couple more BH Links to try to get some of the heat off the emergency rooms. How many people, if you know it, does BH Link see per month?
So we typically look at daily averages that are roughly between 5 and 8 clients a day. Recently, we've been pushing 10.
Wow.
Our goal is to see up to 300 clients a month or more. There's really, again, there's no outer limit. But I agree with you. We've got to get the word out so folks know, come on in. We want to get our numbers up. We're here to serve you.
Yeah. What about when you see these folks coming in? Is it mostly male or female, or is it a combination of both?
It's a combination. Yeah, we do see some pretty good diversity across all indicators, really.
I wonder when, do you see children?
We do not. 18 and up.
18 and up. You know, because that's one of the things, too, that's been a thorn in my side.
Yeah.
Adolescent treatment care in Rhode Island. But, you know, I see the plan when it was in an incubator form, and now it's out of the incubator, and now it's growing. It's growing to the point 200 to 250 is a big number. Is a big number. Now imagine if those 200 and 250 were in the emergency rooms. I mean, I've heard wait times of 8, 12, 16 hours.
Yep.
You know, and that could be frustrating to someone who needs help, who is in pain, who is having mental health issues. I don't know whose brainchild this was, this BH Link, but whoever it was, I think they hit the nail on the head. Now, if we can just expand on that, we'd be better off as a state and better off getting these people help when it's needed and needed quickly. Staffing. What is the staffing over there? I mean, am I going in there and just seeing one nurse and only one worker? And
so staffing at BH Link is, you're sort of seeing the tip of the iceberg when you walk in. I'm going to speak for a second, though, to our call center that's also on site, because the numbers we just referenced are for the in-person walk-ins. But we are also operating the 401-414 Link line. That is the informational line for BH Link. Folks are calling in crisis. We're often able to stabilize and refer just over the phone. Sometimes loved ones are calling, concerned about a family member, so that service is essential as well. We also have the 988 Suicide and Crisis Lifeline on site at BH Link. That is shared, all part of Community Care Alliance, contracted to Horizon Healthcare Partners. So there's a great number of staff behind the scenes, really at the point of phone call if people choose to call first, helping facilitate traffic, stabilize on the back end. When folks walk in, we do have a robust team of nurses, certified peers, prescribers, clinicians, frontline staff, and others, as well as a really robust management team. It's quite an operation. You may see, 2 or 3 people during your stay, but there could be 10 people behind the scenes working on your care.
what's behind curtain number 1? Let me ask you about 988.
Sure.
You work closely with 988?
Yep, so that's one of my programs as well. It is operated at the same site. We are one of the only sites in the nation that has a co-located suicide and crisis lifeline and walk-in triage center.
What about, excuse me, police departments? You work closely with municipal police departments?
We do, and we're always happy to further that relationship. We recognize that in an ideal world, you would have folks calling 911 for a true life-threatening medical or psychiatric emergency, calling 988 for other needs that could be best served in a community manner. When 911 dispatches out an ambulance, our analogy for that, 988 can dispatch out a mobile crisis team. And when 911 is bringing someone to a hospital, 988 and mobile crisis teams can bring someone into BH Link.
What is a mobile crisis team?
So you said BH Link is one of the best kept secrets. Our mobile crisis teams are too. Rhode Island has actually had enormous success in behavioral health over the past few years. October of 2024, we went live with 24/7 mobile crisis teams covering almost the entire state of Rhode Island. We at 988 and BH Link work closely with all of these teams. It's an integrated crisis care continuum.
So what do they do?
Anyone experiencing a mental health emergency can either call 988 or can call their local certified community behavioral health clinic, or CCBHC. And if it's an emergency, a mobile team of clinician, nurse, and or a peer can respond to you within 1 hour in your home or out in the community.
So the mobile crisis, I mean, is it a mobile unit? Do they just jump in a car?
Usually they're just
a
jumping in
taxi?
a car. Yep,
Okay.
that bat signal goes up, they're coming out to see you. They can bring you into BH Link, they can stabilize you on scene, they can refer you oftentimes to a next day or same day appointment, and we're all working together in this space so that Rhode Islanders have non-hospital based access to emergency services.
So you just hit the nail on the head.
Yep.
Non-hospital based care.
Yep, and it's an enormous relief to our partners, our first responder colleagues.
What other type of issues can you handle at BH Link? I know mental health, substance use. Is there anything else? Is there like high blood pressure? Is it diabetes? I don't know. I'm asking the question.
It's a great question. So we're not a medical unit per se, but we know that people's social determinants of health are often influenced by their mental health and vice versa. So if somebody has a mental health issue that is impacting the way they, say, treat their diabetes or treat their other health conditions, or if a housing issue is affecting their health and mental health, we're trying to address the whole person. So we won't necessarily treat your blood pressure as a primary concern on site, but we will coordinate with your medical providers. We may get you to a crisis stabilization unit, another Rhode Island secret, a non-hospital based inpatient solution, so that you can get treated medically and psychiatrically.
So if I come into BH Link, are you able to look at all my medical records? Are you hooked up to that?
Not always,
system?
but we can at least request, and we can collaborate with your existing providers, and we do. We do a high degree of case
'Cause
consult.
I know sometimes when people walk into these type of places, even urgent cares, sometimes they don't have all the information
Right.
that they need to make a determination
Yep.
of your health.
Yeah.
Okay.
Yeah, and we're a crisis center, so we're largely, what is your immediate crisis? What are we trying to stabilize today? And then where are we referring you for follow-up care?
We're going to take another quick break. You're doing a great job.
Thanks.
You're watching Recovery TV, and I'm your host, John Tassoni. We'll be right back after these messages.
And now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, Kodak. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Katie Anderson is in the house with CCA. We're talking about BH Link, and Katie is the Vice President of Acute Services for CCA. So welcome, and thank you for all you do.
Thank you.
People don't realize how important it is to have an organization like CCA tackle an issue like this and to help 200 to 250 people a month. Not a year, a month. So do the math. It's very rewarding that people can go in, walk in like you said, receive treatment. They don't have to wait 16, 17, 18, 20 hours in the emergency room, and they can get what they need and go home and become productive citizens again. So thank you for what you do. I know CCA is a 501c3, so if people are watching and they want to donate to CCA, please do. You can find them on our website. I think the website will be put up. BH Link will be put up. And what you do, I can't thank you enough.
Thank you.
I can't thank you enough. And to get into this business, we need good people like yourself. It's hard. It's not an easy business. People are suffering. People are hurting. And you see that day in and day out. After a while, it wears on you. It wears on you. At least, most of us can go home at night, put our heads on the pillow, and say we did the best that we can.
That's
So I
exactly
want
right.
to thank you for coming on today. Greatly appreciate that. My guest next week is Senator Sheldon Whitehouse. And if you want to stay on, you can see Kodak Live, a fully integrated healthcare system. So if you see something, folks, say something. We'll see you next week.